You're watching CTOM TV. Knowledge is power.
You've just spent all this time talking about how critical testing tumor tissue is, whether for overexpression or tumor DNA and certain mutations. So tell us a little bit about this.
Yeah, so because of this technology and there's so many great new technologies being applied to cancer right now, it's hard for the medical system to catch up. Yes. It really is, all at once. Certain hospitals will adopt a new technology that others don't have. One of the biggest problems right now in Canada specifically is when they do take a biopsy, they don't always do it through a PET CT. So a PET CT will allow you to determine what is the most aggressive tumor, and that is obviously the best one to biopsy. In many cases, doctors will just choose a tumor based on its size, and it may not have a lot of tumor cells in it. It may only have 20% tumor cells in it. And that's not going to provide a lot of DNA or RNA for accurate genetic testing. So we find that in Canada, probably 40% of the biopsies we get fail. And that's unfortunate, but we have a solution for that. What we do is we have this great new technology now called a laser technology. It's a laser beam. It's very expensive, unfortunately, but it is a wonderful new technology. So we have a lab in the States that we send our Canadian biopsy samples to, and they use this laser beam that can scrape these tiny tumor cells off without damaging them and help release the DNA and the RNA. And we also have invested in a lab that does tumor DNA sequencing with a robotic system that is specific to poor quality biopsy samples. So when we use one of the popular or FDA approved technologies, we get a lot of failures. In other words, they'll take the sample and 40% of the time, sometimes 50% of the time, they'll say, here's your results. Sorry, it's not so good. We didn't get a lot of DNA and RNA. It was poorly degraded. So we're working on that. And two of the technologies we're using right now is this laser extraction process. And then also our new sequencing technology that is optimized for poor quality biopsy samples.
I just want to add two things there, or just clarify a few things. That 40% of the time, 40+% of the time is not our statistic. You just said we find, but that was the big we. There are numerous clinical studies that have presented this statistic. And you also mentioned something about very expensive. And in reality, if we think about quality of life and making sure you get the right treatment and that you don't waste your biopsy sample on a test that has a likelihood of failing, like Alex was just talking about. But if we talk about standard testing, the preparation of your sample usually costs a few $100s, but this is the standard testing that fails more than 40% of the time. Using the laser separation costs about $1,200 as opposed to a few hundred, which, for some people I appreciate might be a lot. And when you're thinking about making sure that you actually get this testing, get the right treatment, is not an exorbitant sum. So that I wouldn't call it very expensive for most people. Just wanted to point that out.
Thank you. Yes. And I was referring to we as a scientific community.
Okay. Yeah. How your biopsy is treated once the surgeon has removed it from your body, whether through needle or scalpel or however your process was, how the surgeon handles it, not just what Alex said about where they get it from in your body and making sure that's a good tumor to produce lots of that tumor cells, but how the surgeon handles it, how the pathology lab treats it, even things like what's the weather like. If it's really hot, certain types of tissue like RNA will degrade much more rapidly. So there are techniques and protocols in place now in some countries around the world to address this issue, to make sure that surgeons are well educated, that tumor tissue is well handled. But it isn't being done here just yet.
Yeah, I like the old adage they used to say. I remember, never buy a car that was made on a Friday, and never get a biopsy done on a Friday.
Because your sample will sit for days before anything
Potentially,
happens to it.
yes.
Yeah, it's a good, we could go on about those things, but yes, so there are ways, again, to make sure that you get a biopsy from the right and best place, that it's well handled. Now, for many of you watching this ship may have already sailed. You may have already had your biopsy, and that's why we went over the concept of the laser separation, because we want you to know there's always hope. There's always a way, there's always a workaround. You just have to know about it and know what to do to get it. So now you know, if you're not sure how your biopsy sample was handled, or they said there wasn't a lot of tissue there, you absolutely want to make sure you have the laser separation process done, and not just send your tissue off to one of these facilities, because they will use the tissue that is there and you won't get a full result. So
Thank you for watching CTOM TV. Subscribe below and stay informed.